Julie Wheeler is anything but simple. She is the president and commissioner of the York County Commissioners. Very sharp lady. Has been in industry and business for a long, long time, and now has the wonderful business during COVID of being president and commissioner of the York County Commissioners. And she joins us here on WSBA Morning News with Gary Sutton. Good morning, Julie. How are you?
Good morning, Gary. I'm doing great. I'm on.
Well, how'd you like that intro? That was a pretty good one, right? I mean, yeah. Aren't you glad you're president and commissioner during COVID? It certainly has provided a number of different things from elections to just regular things. And we wanted to get into some of that this morning. And the biggest story right now is COVID. The cases rising here in York County as well as around the state, around the country, around the world. I guess what I want to ask you this morning out of the gate is what new or additional preparations are being done on the county level right now to kind of meet a potential demand? Your thoughts on all that?
Yeah, sure. If I could, one comment, just like COVID is a virus much like the flu. It's not the same as the flu, but it is a virus. And I think we're all aware the flu has some seasonality to it. And in part, some of the increase in cases now that we're seeing is likely due to a seasonality with COVID. I think the great thing, we are still continuing to do the same things we've been doing through the pandemic the past 9 months. We have a regular call with our two largest healthcare providers, UPMC and WellSpan. We have one, I have it biweekly, and we talk about things like bed capacity, ventilator capacity, all of those things. So nothing has stopped just because we had this little thing, this big thing called an election. So we are still doing all of those things that we've been doing. We know that there's a vaccine on the horizon, whether that comes from Pfizer or another company. I want to assure your listeners out there that the county's been planning for this. We do have a mass vaccination plan in place. We've been working on that for quite some time. We were directed by the state through PEMA to have a plan in place. The target is to be able to vaccinate between 20 to 30% of our population over a 3-day time period. So a pretty lofty goal, but we do have a plan in place to address that. And, the great thing, York County is set up as a best practice we have in our region. We have other counties like Lebanon and Cumberland who are modeling our plan. So we are getting prepared for the day when a vaccine is available for our community. When
you look at, one of the things I would ask you from a personal standpoint is when you looked at this job, did you ever realize you would be planning so far ahead? Did you ever think that you would be looking out? I mean, you've been in business, as I said, for a long, long time, and so planning ahead is kind of part of what you do, and you are painstakingly particular on what you do as well. People don't know you. I can tell them from experience. Julie pays attention to the little details like no one I've ever seen. But having said that, did you ever think you'd have to plan out in front so far here on this? It seems like you're constantly having to kind of, run way out in front here on the horizon so that people, when they get the horizon, are going to be they're going to be there in a prepared way.
Yeah, I mean, as you know, in business we do strategic plans, and we look at, short, mid, long-term plans. The unknown, especially with COVID, is what's going to happen, right? And how do you plan for something that we're still learning about? So we're doing our best here to stay one step ahead. I think the great thing is that we do have a really good partnership with WellSpan and UPMC. So we're kind of all in this together, trying to fight this thing called COVID.
We heard from WellSpan this week that they had 3 times the number of patients in the hospital right now than they had back in April. We also saw new protocols that they're putting into place in terms of who can come to visit. They asked to put off, there were questions about putting off, elective kinds of surgeries now again. We heard some of that back in March and April. Are they telling you from UPMC or WellSpan any particular things that maybe the public should be aware of that they don't know right now, Julie?
No, I think the message sent from WellSpan and UPMC has been pretty consistent. Limiting visitors. We know that right now COVID is really being spread by the community, and that's movement of people is part of what is a contributing factor to the community spread. So nothing different than continuing to, wash your hands, watch your distance, and wear a mask. The one thing I would say, you're correct. We have seen an increase in cases in hospitalization, But in addition to that, just some additional data, we haven't seen as many patients move into the ICU or move on to ventilators. And I think part, again, it's been a learning curve. We've been in this 9 months. We've learned a lot since the spring, and we know that there's treatments like remdesivir that are helping to lessen the symptoms. It's not a cure. We don't have a vaccine yet, but certainly treatments like that we've learned a lot about, and we're not seeing as many patients move to the ICU or on ventilators.
Now, the other part that we also look at, and obviously the most important part, is number of deaths. And, one death is too many, but we've seen numbers of deaths increase. Again, are we seeing that happen to younger ages from what you're learning from UPMC and also from WellSpan, or is it still relatively low compared to the number of positive cases, I guess is the question I want to ask here.
Yeah, it still remains pretty low with young individuals unless those individuals have an underlying health condition. We do continue to see older adults and individuals with underlying health conditions be susceptible and succumb to COVID. I will say, in New York we did see a spike in the spring in our nursing homes, long-term care facilities.
Right.
It appears that they also learned a lot through this and right now are kind of holding their own. When we talk about, earlier we talked about mass vaccinations. The federal plan, there's a Part 1A and a Part 1B, and the great thing for the folks living in our nursing homes and long-term care facilities is that they're in that first round of vaccination because they're deemed at high risk. And
Right.
We're already working with the plan right now is that the local pharmacists will form teams and they will actually deploy into those facilities to vaccinate the residents in those types of facilities.
Julie Wheeler, President Commissioner of the York County Commissioners, and along with her fellow commissioners, doing the job out there for York County. I think we can be very proud of what they're trying to get done right now and what they've been able to get done so far. The elections, quick postmortem on that, Julie. We saw this week that a record number of York Countyans came out and voted, which is a good bit of news. A few minor problems here and there, a few inconveniences here and there, but for overall look, looks like York County was very efficient, got it done in an efficient way. What's your take on it?
I would agree with you. It was a record turnout, 77% voter turnout in York County. That's a record for York County. Back in 2016 in the general election, York County was about 71%. The state of Pennsylvania this year in the general election, they were at about 70%. So I just commend the voters of York County for coming out to vote. I would encourage them to come out and vote in the off-election years. I would love to see that type of turnout next year when we have our election.
77%. I mean, that's astounding. So you 23% out there. Get on the stick. Let's go.
Yeah.
Also this week we saw the story out about the budget. It's always a big deal here in York County and anywhere else in our homes. And we found out there are no new tax increases this year. But then there was kind of a but about 2022. Tell us about that.
Sure. I guess there's always a but, right? But let's talk about next year's 2021. The counties worked really hard and took some very tough financial decisions earlier in the year. We all know that the county furloughed some employees, but we also, county row officers and department heads tightened their belts, I should say, tightened their belts on expenses, and expenses were way down for the county this year, which is great. But we also know our revenues were down. The courts weren't open for several months this year, so revenues from cost and fines down about $1.2 million, and we had some intergovernmental revenues that are down. But all in all, we made some very prudent decisions early in the year, which set the county up to actually end the year with a bit of a surplus. So that's great for York Countyans because we're going to roll that surplus over into next year, which is one of the reasons why we've been able to balance the budget for 2021 and not raise taxes. I'd say a big unknown for us right now is what's going to come down from Harrisburg when they pass their budget. We get a big portion of our budget does come from the state, and we certainly put that into have that in play as to what's going to happen there. We have a little bit of wiggle room. We're anticipating we're not going to get as much funding from them in 2021.
Now, so basically to kind of summarize, you're taking the 2020 surplus that you had to balance the 2021 budget, but then in 2022, because of budget cuts from the state and federal governments, obviously then you're looking at a reduction in services or possibly a tax increase or a combination of both, right?
Yeah, I mean, certainly we have to look at all of those factors. I'm cautiously optimistic that we won't have to go that route. We're going to get into 2021, and then we're going to start tackling those issues in 2021, and hopefully we'll close the end of the year in 2021 like we did this year. Big unknown is what's going to happen with COVID. I mean, I will say the county was fortunate that we got $40.5 million from the federal government in CARES funding. That certainly was a huge help to us in doing some reimbursement. Don't know if we're going to have that or not next year. We certainly know COVID's not going to go away, so we're optimistic that we will continue to get some help from the federal government along those lines.
Now, I was looking in the paper the other day and reading about this, and it said, one of the things we talked about, and you mentioned the hundreds of employees who were furloughed. That's a sad thing anytime we have to furlough employees.
Yes, it is.
But also a number of the county's buildings had to be shut down, too. Tell us a little bit about that.
Yeah, early on when we were in the red phase, we did close down all the buildings to the public. I will say all of our buildings now are open to the public except for our Human Services building. We will continue as long as we're permitted by the state. We will keep our buildings open to the public, certainly following the guidelines set forth earlier this week regarding masks. We have been mandating masks in our buildings for quite some time, so we will continue to be open for business.
We talked about how COVID has had an effect on just about every aspect of our lives, but when it comes to county government, it had little effect on your largest source of revenue, which is real estate taxes, right? Talk a little bit about that, if you would.
Yeah, if you recall, earlier in the year, the Board of Commissioners made a decision. We have under our purview to modify the amount of the penalty with the taxes, and so we made a decision to basically lower the percentage to 0%, which in essence is, extending the face value. So we did that. I have to say, Gary, that really didn't make a huge difference in when we got our revenues in from the real estate taxes. We still got a majority of those in by the April 15th cutoff period. So we're very thankful that people, pay their taxes. A big chunk of that, of course, is a lot of folks escrow their taxes. So that money was already set aside, and we received that directly from the mortgage companies.
And that makes up 72.5% of your revenue. So that is a big deal. And, of course, as you mentioned earlier, $8.5 million in the hole this year, but the $10 million surplus took care of that. And, again, the big question mark is what kind of money is going to come down in 2022. And we'll talk about that when that time comes. I know you'll be planning out ahead on that. And any other things you'd like to say to people out there, Julie? About 10 seconds left in this one. And we wish you, by the way, a very happy Thanksgiving. And thank you for all of what you and the other county commissioners and all the people associated with you have been doing. But final thoughts from your end.
Yes, I could. Two things. One, I just, again, want to thank the county employees who stepped up to help with the election, but also the hundreds and hundreds of volunteers who worked the polls for the county, because we could not have been successful if it wasn't for them. And then I would, my parting comment would be, York County did a great job in the spring mitigating COVID. We need you all to step up again and continue to do that so we don't see a huge resurgence here in the community.
Julie, thank you so much. A very happy Thanksgiving and a very big thank you to you and all the volunteers for what you've been doing for the county government. And we appreciate and look forward to talking to you again very soon.
Sounds great. Take care, Gary.